hugas at iwas po ang ating mga kababayan. Maraming salamat siyempre po kay Presidente Rodrigo Roa Duterte dahil siya po ay pumayag ng maging endorser ng mask, hugas, iwas. Humarap po muli kagabi ang ating Presidente Rodrigo Roa Duterte sa taong bayan para sa kanyang ulat sa bayan, no? O yung tinatawag nating Talk to the People address. Sinabi ng Pangulo ang kanyang kagustuhan na mabakunahan ang lahat ng Pilipino laban sa COVID-19. Dagdag ni Presidente, uunahin na mabigyan ng libreng bakuna ang mga Pilipinong kasama sa listahan ng Pantawid Pamilyang Pilipino Program or 4Ps. Alam niyo po, sangayon po doon sa ating universal healthcare, pwede po talaga mabigyan ng lahat ng libre. Pero dahil alam natin na magiging limitado initially ang vaccine, uunahin po natin ang mga mahihirap. Pinuri rin kagabi ang mga Pilipino pati na ang mga pinuno ng mga lokal na pamahalaan dahil sa pagsunod at pagpapatupad ng health protocol sa gitna ng pandemya. Patuloy po tayong magmask, hugas at iwas. Iniulat din sa Talk to the People address na may mahigit 8 bilyong piso na halaga ng shabu ang sinira bilang pagsunod sa kautusan ng Pangulo noong nakaraang linggo. In-report din kagabi na mayroong 41,068 qualified contact tracers at sa bilang na ito, 34,057 na ang na-deploy sa ibang mga probinsya. Samantala, mahigit 254,000 overseas Filipino workers naman ang na-repatriate at naibalik na sa kanilang mga probinsya ngayon may COVID-19. Sa ibang usapin, nagbigay ng pahayag ang World Health Organization na huwag iasa sa lockdown ang paraan para makontrol ang pagkalat ng COVID-19. Quoting Dr. David Navarro of the WHO, he said, "The only time we believe in lockdown is justified is to buy you time to reorganize, regroup, rebalance your resources, protect your health. Workers who are exhausted but by and large would rather not do it." Dagdag ni Dr. Navarro, and we quote, "Lockdowns just have one consequence that you must never ever belittle, and that is making poor people an awful lot poorer." Ito pong dahilan kung bakit inaprubahan po nung huling meeting ng gabinete ang bahagyapang pagbukas muli ng ating ekonomiya. Dito po sa ating slide na makikita nyo, ito po yung ginamit na slide ni Secretary Chua. No? At ito po yung nagpapakita na dahil nga po sa mga quarantine na ngayon po ay meron na tayong mga total cases na 300,000 plus, mga active cases na 42,000 plus at mga COVID deaths na 6,000 plus, mas mabigat po ang naging halaga o danyos ng COVID pagdating po doon sa kagutuman. No? Na-estimate po natin na mas marami pong nagutom dahil nga po sa COVID, 23.7 million. No? Ang additional poor po natin ngayon ay 4.3 million. Ang additional unemployed ay 2.3 million. At yung all other deaths, bukod pa po sa COVID, ay napakataas na po. No? Sa 213,160. So alam ko po na babahala kayo na baka naman dahil sa pagbukas muli ng ating ekonomiya, hindi naman po completely bukas yan, pero mas bahagya pong binuksan pa, baka dadami po ang mga kaso ng COVID-19. Dadami po yan pag hindi tayo nakinig kay Presidente. Kinakailangan po mask, hugas at iwas. Ito naman po ang ating COVID updates. Sang-ayon po sa Johns Hopkins University, 38 milyon na po or 38,416,443 kaso ng COVID-19 sa buong mundo. Merong higit na 1 milyong katao naman or 1,090,641 ang binawian ng buhay dahil sa coronavirus. Nangunguna po rin po ang Estados Unidos. Pangalawa ang India na may pinakamaraming kaso ng COVID-19 sa mundo. Sinundan ng Brazil, Russia at bago na po ang panglima para pong Miss Universe, Argentina, hindi na po Colombia. As of October 14, meron na tayong halos 4 na milyon or 3,976,980 total individuals na na-test na po using 112 licensed RT-PCR laboratories and 35 licensed gene expert laboratories. Mayroon na po tayong 46,227 active cases ang ayon sa October 14 case bulletin ng DOH. Sa mga kasong ito, 84.5% po ay mild, 10.5% ay symptomatic, 1.6% ay severe, 3.3% ay critical. Parami naman po ang mga gumagaling. Meron na po tayong 293,816 na nai-report na recoveries as of October 14. Samantalang malungkot ko pong binabalita na meron na po tayong 6,449 na na-report na binawi ng buhay dahil sa COVID-19. Pumunta naman po tayo sa recent distribution of cases. No, tingnan natin ang number of cases at growth rate ng cases sa Pilipinas at Metro Manila. Dito po sa slide nito, bagamat maliit, makikita nyo po na yung average 2-week growth rate ay bumaba po para sa buong Pilipinas. So mabuting balita po yan, and congratulations Philippines. For the past 2 weeks, bumaba po siya by 18% or negative 18%. Dito po ang ating daily attack rate po ay 2.35. Mataas po yan dati, no? Pero ang ninanais po natin ay maging 1 or mas mababa pa. Sa Metro Manila naman po, bumaba po, napakalaki po ng binaba sa Metro Manila. Naku, salamat po sa pagtugon, no? Sa mask, hugas, iwas ng ating presidente, bumaba po ng 31% sa Metro Manila. Ang daily attack rate po sa Metro Manila ay 6.61% na napakalaki rin po ang binaba. Gayunpaman, meron po mga areas na tumaas at sana po sa mga areas na ito ay gumawa ng hakbang para mapatupad lalo pa yung mask, iwas, hugas. Ito naman po sa slide natin ang confirmed deaths every week. Makikita nyo po na meron 3 araw na bahagyang tumaas, pero ang trend po ay patuloy pong bumababa ang mga confirmed deaths on a weekly basis. Sa critical care capacity po ng ospital, wala po tayo sa critical. Meron pa po tayong 52% available na ICU beds. Meron po tayong 55% available na isolation beds. Meron po tayong 57% available na ward beds at 73% available na ventilators. Now, ito po yung R0. Naalala nyo po yung R0. Ang R0 po, ito yung ilan yung nahahawa ng merong isang positibo. At makikita po natin dito na bumaba na po ang ating R0. Ito po yung mabuting balita. Ang objective po natin ay 1 or pababa. Nakamit po natin yan. Nasa 0.98 po tayo. Napakaliit po, no? Hindi natin makikita, no? Pero 0.98. So patuloyin pa po nating pababain ang ating R0. Okay. Sa ibang balita, naku, mabuting balita po at congratulations po kay Secretary Mark Villar na kumpleto na po ang Metro Manila Skyway Stage 3 Expressway. Ibig sabihin, makukonekta na po ang NLEX at SLEX. Makikita nyo po yan sa video ito. Ibig sabihin po, hindi na dadaan ng EDSA ang manggagaling ng NLEX papunta ng SLEX. At pwede na rin pong daanan yan para dun sa mga tao na babiyahe sa Quezon City na gustong umiwas sa EDSA. Pangalawang mabuting balita po, maraming salamat po sa Senado, no? Dahil matapos ma-certify ng Presidente ang as urgent ang Senate Bill number 1844. Na-certify lang po ito at kung di ako nagkakamali, kahapon lamang, abay, naipasa po ng Senate on third and final reading itong Senate Bill number 1844. Thank you very much, Senate President Tito Soto. Thank you very much to Senator Bongo and the other authors of this bill. No? Nakasaad po sa Section 2 ng nasabing panukalang batas, and I quote, na ang Presidente daw po ay binigyan ng otoridad to suspend the requirements for national and local permits, licenses, and certifications, and to streamline and expedite the process or issuance of permits and other government regulatory provisions. No? So, ibig sabihin po niyan, kapag ninais na ng Presidente, wala lang permit, go na ang proyekto. Wala ng red tape na kagustuhan po ng Presidente. Ulitin ko po, maraming salamat sa Senado. Matapos lamang po ng isang araw, matapos may certify urgent ng Pangulo ang panukalang batas na ito, naipasa ng senador natin, mga senador natin, ang panukalang batas na ito. Maraming salamat po. Dito po nagtatapos ang ating presentasyon, pero bago po tayo pumunta sa ating open forum, weekly po natin kasama siyempre, walang iba kundi ang National Task Force nating Chief Implementer Carlito Galvez para po sa kanyang update sa COVID-19. Kasama rin po natin si LTFRB Chair Martin Delgra kasi nga po marami nagtatanong yung inapprove ng cabinet na every other seat, kailan ito mapapatupad at safe ba ho ito, no? Well, alam nyo po, bago magdesisyon ng gabinete, pinakinggan po ng gabinete ang mga dalubhasa. At sangayon po sa mga research na published ng leading medical journals, basta po sumusunod sa 7 commandments, merong face mask, may shield, proper ventilation, regular disinfection, walang usapan, walang kainan, po pwede naman pong maiwasan ang COVID-19. Sabi nga po ng infomercial na kung saan ang endorser natin ay ang presidente, kinakailangan lamang pag-ingatan ng buhay para makapaghanap buhay. Secretary Galvez, Chief Implementer of the National Task Force on COVID-19, the floor is yours.
Sa ngalan po ng buo ng National Task Force on COVID-19, isang magandang araw sa ating lahat. Bago po man nagsimula ang implementasyon ng ating National Action Plan against COVID-19 Phase 3, ay ginagawa ng pamahalaan ang mga nararapat na hakbang upang tuluyang buksan ang ating ekonomiya. Ibabalita po natin ngayon na talagang bumababa na po ang ating active cases. In fact, nakita po natin na from 88,000 nung kasulukuyan ng August 15, yung pinakataas na peak po natin, na ipababa po natin ang active cases po natin ngayon ng 46,000. Sa Metro Manila po, malalaman po natin na ang ating Metro Manila, more than 20,000 po ang active cases. Nag-report na po sa amin ng MMDA, na si GM Jojo Garcia, na ang kanilang active cases ngayon ay more or less 7,830 na lang. Meaning from more or less 26% active cases, ngayon nasa 6% na lang po ang active cases nila. At nakikita po natin talagang mga negative growth po ang nangyayari sa lahat po ng po natin, Metro Manila mayors. At nakikita po natin na yung mahigit po na 12 city ang meron pong more than 90% ang kanilang recoveries. Maganda pong pangitain po yan dahil kasi po pagka po naitaas po nila na 95 to 97, lalong bababa ang active cases natin sa 5%. At noong po nagkaroon po kami ng cabinet meeting noong Monday, ay mayroon po tayong tinatawag na mga presentasyon ng mga experts na ang recommendation po nila magkaroon po tayo ng tinatawag na enforcement of the 7 commandments. Nasabi na po ni Secretary Harry Roque na we have to wear proper mask, wearing of face shield, no talking and no eating, and adequate ventilation, frequent and proper disinfection, no symptomatic passengers to be allowed doon sa mass transport, and also appropriate physical distancing. At nakikita po natin na marami na pong mga countries ang nakikita po natin na nakakaroon po ng tinatawag nating na appropriate distancing. Sa Japan nga po nakikita po natin na ang kanilang seating arrangement ay makakadikit. Pero ang po nila, they are observing yung no talking at saka no eating at no using of cellphone. So nakikita po natin na sa ngayon sa ating pagbubukas ng ekonomiya, napag-uusapan po sa kabinete na kailangan talaga po natin buksan na ang ating transportasyon. So nakita po natin na sa ating susunod na mga hakbang ay talagang magagawa tayo ng estratehiya with the DOTR na magkaroon po tayo ng maximum ng ating mga sasakyan. As we move forward sa phase 3, we need to implement the following actions. I-implement pa rin po natin yung ating reinvigorated prevent, detect, isolate, treat and recovery, and going to new normal. Yung phase 3 po ito magiging parang transition plan po natin para po sa new normal. At dito po gagawin po natin, we will emphasize more on the prevention and detection side. Nakita po natin na yung ating infomercial po na ginawa po ni Sir Harry Roque na ingat buhay para sa hanap buhay, at ang ating tinatawag na coordination with the business sector, ito pong ingat-angat tayong lahat ay naging maganda po ang traction sa ating prevention side. At sa ating detection, ginagawa po natin ay may mga code teams na po tayo sa ating mga barangay with the active case finding and syndromic surveillance. Ito po ay para po mahiwalay po kaagad ang mga may symptoms even without testing. At sa isolation po talaga, kailangan po natin na implement po natin yung no home quarantine at saka po yung expanded offline kalinga para po ma-extract po natin ang mga positive cases. At papaigtingin po natin sa treatment yung one hospital command. At amin po inimungkahi na i-strengthen pa rin po natin ang ating quarantine measures and minimum health standards in business establishments and the workplace. Pagka nag-open po tayo, talagang kailangan po natin na mas maigting po ang ating minimum health standard. And then also, ang strategy po natin is to open up our economy is to provide sufficient transportation for workers while ensuring health and safety ng ating mga kababayan. At ano po natin, sinasabi nga po natin na we will encourage patients to avoid yung no home quarantine through offline kalinga. And then also, mga lessons learned po natin, especially sa Cebu, kailangan strengthen po natin talaga ang ating partnership with the LGUs, the private sector, and other stakeholders. Katulad ng ginagawa po natin sa tinatawag nating Ingat-Angat Tayong Lahat campaign. At i-institutionalize po natin ang ating COVID response at the city, municipal, and barangay levels. Kasama po sa estratehiya po natin sa NAP2 na we have to localize our strategy. And then we will also strengthen yung barangay health emergency and response teams or BHERTs at ang ating barangay isolation centers as well as active case finding and surveillance. Ito po, napakaganda po nito. Ito po sinasabi po ng mga expert na mga pagkukulang po natin yung active case finding. And then sa mga regions, i-replicate po din po natin yung one hospital command referral system together with the LGUs, health professionals, the business and the security and religious and other key stakeholders working together in one stop shop. And then nakita po natin sa presentasyon po ng ating mahal na secretary ng NEDA na napakalaki po ng mga cases natin sa non-COVID. So sa strategy po natin na ngayon ay talagang palalakasin po natin ang ating healthcare system with the non-COVID patients. And then we will carry out more aggressive contact tracing, testing, and treatment and isolation measures so that we can bring down our active cases to the lowest manageable percentage. And also, nakikita po natin na hindi po natin maiwasan na magkakaroon po ng tinatawag na politika sa ating COVID-19. So, ginagawa po natin ay pumupuntahan po tayo and we bridge political divisions through the unity of effort and unity of command process. So, ginagawa po natin ay pinagbabati po natin ng mga iba at nakita po natin, mga experience po natin sa mga lugar na mataas ang kaso. Ngayon po, nung nagkaisa-isa po sila, at nagkatulong-tulungan ay naging mabuti na po ang kalagayan ng kanilang mga lugar. So ang ano po natin, to way forward, we have to reduce new cases and active cases and we have to minimize deaths and we have to increase yung recoveries. Ito po mga strategy po natin at saka mga benchmark po natin. With all of this, I'm confident that we can further reduce the transmission, gradually bring our vibrant economy back as we transition to the new normal. Maraming salamat po at mabuhay po kayo tayong lahat.
Maraming salamat, Sec. Galvez. Sec. Galvez, siguro po pwede nating i-rekomenda sa mga hospital na habang nasa 50% lang po ang ating utilization rate ng ating health facilities, baka po pwedeng pagbakasyonin yung ilang mga frontliners natin para sa ganun ay makapagpahinga habang hindi pa po critical ang ating critical care capacity.
Opo, gagawin po natin po yun at we will recommend that to our One Hospital Command. Yusek Vega po.
Maraming salamat, Secretary Galvez. Pumunta naman po tayo kay LTFRB Chair Martin Delgra. Sir, paano na natin papatupad yung inaprubahan ng gabinete at ng presidente na every other seat? At ano pa ba ho yung mga additional transportation na papayagan natin dahil ang report nga po ni Secretary Chua, 58% of the economy ay bukas na and yet ang transportation po natin ay nasa 30% lamang. Chair Delgra, the floor is yours.
Salamat po, Secretary Harry Roque. Magandang umaga po, Secretary Charlie Galvez and Yusek Ignacio. Salamat po. Magandang umaga sa inyo lahat, pati na rin po sa mga kaibigan natin sa media at sa mga nanonood dito sa programang ito. Unang-una, nagpapasalamat tayo na inibitahan tayo at maipalathala natin sa mga nanonood at nakikinig patungkol sa ginawa at ginagawa ng Department of Transportation sa alinsunod na rin sa mga desisyon na ibinaba ng kabinete nung nakaraang Lunes. As a result of that, Secretary Togade met us the following day to download the instructions that were already approved by the cabinet. And consequently also, nagpatawag po tayo ng, insofar as the LTFRB is concerned, nagpatawag po tayo ng special regional directors meeting the day after that. So para lang maibaba at ma-instruct na rin po natin yung mga regional directors kung anong gagawin nila doon sa regional level. At having said that, may we be allowed to present a short presentation po sa mga ginagawa na po ng Department of Transportation sa pamumuno ni Secretary Togade, alinsunod na rin sa mga desisyon at direktiba ng ating Pangulo nung nakaraang Lunes po. May we be allowed, please?
Yes, please. Go ahead. The floor is yours.
Opo. I could not, I'm sorry, but I have to see the slide. Is there something? Can we have the full screen, please? I understand that. Can we seek the assistance of your staff?
Ayan na po.
Secretary
Naka-full screen
Ayan
na po kayo.
Opo. Thank you very much. Unang-una, we already have received the instruction na gagawin na pong one seat apart in all public transport. Natutuwa po tayo sa itong balitang ito, although it's still a challenge to address public health. We all know how it started, how this issue started, because we need to address public health principally while we move the economy. As you know, one mover of the economy, for that matter, is transportation, and more particularly public transport. And now that we understand na pwede rin palang maitaas yung kapasidad ng ating mga public transport system without having to compromise public health, so long as the other public health protocols are in place, we are happy that we would now be allowed to increase the capacity in our public transportation. Doon na rin sa direktiba ng kabinete na pwede na pong one seat apart in all public transport vehicles or all public transport system. As a result, we will be increasing public transport capacity, and that there is also a directive to increase the number of units that would be running on the road. I'd like to note, however, that when we talk about operationalizing public utility vehicles, dalawa pong klaseng mode po ito. Yung isa po, yung tinatawag nating route-based public transport, at saka yung isa naman po, yung non-route-based public transport. Ang ibig pong sabihin nito, yung non-route-based public transport po, wala po tayong moratorium, suspension, or ceiling kung kailan at anong klaseng public transport ang pwedeng mag-operate. No? Examples of this, yung non-route-based public transport, yung taxi, yung TNVS, yung shuttle service. No? And I would like to cite these things na yung sa taxi at saka TNVS, ang ginawa po ng LTFRB, we have sought the assistance of the TNC, yung Transport Network Corporations, yung mga nagde-develop at nagmamanage po ng mga tinatawag nating mobile apps, because we already have required the installation of these mobile apps sa mga taxi at sa mga TNVS. Mainly because we need to put a contact tracing system in this type of public transport. So, pinadaan po natin sa mga TNC, doon sa mga taxi na gustong magbiyahe at sa mga TNVS. they will submit to us the list, and that so long as they would follow the public health protocols that were already mandated by the IATF, no? Yung disinfection, yung plastic barrier between the driver and the operator, and the limited capacity that were already directed before. And that, by the way, that capacity will increase with the recent announcement na pwede ng 1 seat apart. Yung sa shuttle service na naman po, that has been a continuing discussion, and forums like this, we would always announce and encourage private companies to get shuttle service, no, for their employees. Dalawa o tatlong benepisyo po ang makukuha natin dito if private companies would get shuttle service for their employees. Unang-una, dedicated po yung serbisyo. Ibig sabihin, yung mga empleyado kukunin doon sa mga bahay nila at dadalhin doon sa workplace. And therefore, pangalawa, makakasiguro ka that there is a dedicated service kung saan yung risk of transmission of the virus would be limited. Pangatlo, tulong na rin po ito sa ating mga empleyado. Kasi yung shuttle service na ito, supposedly, libre ito, added benefit ito sa ating mga private companies para mabigyan ng transport service ng ating mga empleyado. So we do encourage and we continue to encourage itong paggagamit ng shuttle service. At madali lang po kumuha doon sa mga public utility vehicles po. They can apply for a special permit. Online po ito. Mabilis po ito yung proseso nito. If they will apply in the morning, they would get it within the day, so long as all the requirements are submitted. Pero meron din po tayong ginawang paluwag dito sa pagkukuha ng shuttle service. So long as you would fall under the exception, kasi pinaluwag na po natin yung requirement na pwede na rin po kayong hindi kumuha ng permit sa LTFRB, so long as you have those requirements in place as set forth in the exceptions po. Ibig sabihin, among others, yung company pwede na pong pumasok sa isang lease agreement with a private vehicle owner, pero yung pagpapatakbo ng sasakyan para to provide public transport ng kanilang mga empleyado, yung magmamaneho at mag-ooperate ng vehicle po, yung employer o yung lessee. At kailangan din po na mayroong comprehensive insurance na gagawin, no? So yun po ang and the lease contract would be for 3 months. Actually sa kasalukuyang direktiba po, tinitingnan natin na hanggang December 31. Hopefully, the environment in addressing the virus would ease up in the following year. Hindi na natin, we would continue to see and monitor how it will be in the coming months. Okay. Now,
thank you, Chair.
Route-based public transport is concerned, mangyari po na meron po tayong mga kasalukuyang route rationalization. Ang pakay po rito, the whole idea of the route rationalization is we have limited transport and therefore we need to maximize the use of the capacity of these units on the routes that they are running.
Okay.
Next slide, please.
Chair Delgra, paumanhin po, no? I'll have to interrupt you kasi may mga questions na po tayo from the Malacañang Press Corps. And gusto po nilang matanong yung mga questions, no? I'm sure yung ibang presentation nyo might be covered by the questions from our partners here in the Malacañang Press Corps. So okay lang po. Let's proceed na to the open forum. Thank you very much, Chair Delgra. We now go to our open forum. Yusek Roque, please.
Yes, good afternoon, Secretary Roque, Secretary Galvez, and Chairman Delgra. From Evelyn Quiroz of Filipino Mirror, you recently told the Okta research team to stop publicizing suggestions on the pandemic response and just privately relay the recommendations to the government. Reading between the lines, doesn't this put the government in a very bad light?
Ay, thank you, Evelyn, for that question. Unang-una, hindi ko po sila sinabihan. Pinakiusapan ko po sila at pinasalamatan ko pa nga sila sa kanilang ginagawa, no, yung mga datos na i-share nila sa public. Alam naman po ng Octa Group yan, no, ilang beses ko na silang nag-guest dito sa ating public briefing at instrumento po tayo doon sa naimbitahan sila sa Malacañang para magbigay ng briefing kay Presidente. Dahil kakilala ko nga lahat po yung mga taga-UP. Ang aking request po, gawing pribado yung recommendation nila pagdating doon sa quarantine na classification na i-impose. Bakit po? Well, tanging Presidente lang naman po ang may kapangyarihan mag-impose ng quarantine dahil this is the exercise of police powers po. No? Ang IATF does not have that power. IATF only has recommendatory powers to the President. So kung ang mga rekomendasyon po nila has to do with yung quarantine classifications, kinakailangan i-address po yan sa Presidente. Or kung ito po ay sa mga non-highly urbanized centers, i-address yan sa mga gobernador dahil sa resolution po ng IATF kung non-highly urbanized cities at mga municipalities at mga barangays, sa lokal na pamalahan po yan. So kung gusto po talaga nila makatulong doon sa rekomendasyon na yon, i-address po nila sa tamang recipient, ang Presidente or ang mga lokal na pamahalaan. Pangalawa po kasi, hindi po natin sinasabi na it puts government in a bad light. Bakit po? Wala pong data gathering mechanism ang Octa. Tanging gobyerno lang po ang kumukuha ng datos. Binabase po nila yung kanilang forecast sa datos din ng gobyerno. So wala po kaming tinatago. Lahat po yung mga datos na yan, nasa webpage po yan ng Department of Health. Kaya nga lang po, napakasensitibo po nitong classification. At sa susunod na linggo nga po, i-step by step ko kung ano yung proseso na pinagdadaanan bago po makarating sa recommendation ng classification, no? Quarantine classification. Ngayon nga po, yung sa rekomendasyon ng Octa Group, nagrereklamo yung mga lokal na pamahalaan. Ganyan pong kasensitibo yan. Kasi pag sinabi mong mataas ang COVID sa isang lugar, nagiging political issue rin po yan sa lugar na yan. Para bagang lagot si mayor, no? Lagot si governor. No? So, hindi naman po ganun ang pakay natin, no? Kung bakit tayo nagka-classification. No? Ang pakay naman natin, para pa nga po mapabagal yung pagkalat ng sakit. So, hindi ko po sila sinusupil. Salamat nga po sa kanilang mga ginagawa. Naimbita ko na sila rito. I will invite them again. And if need be, I will invite them again to the palace. Pero ang pakiusap ko lang po, dahil nga po sa mga recommendations naman nila ay tungkol sa classification, i-address nila dun sa tamang institusyon na gagawa ng desisyon sa Presidente o sa mga lokal na pamahalaan.
Opo. Question for LTFRB Chairman Martin Delgra from Evelyn Quiroz po. When can the public expect the full operations of buses and jeeps in the country? Are there plans to do so in the near future?
Yes po. Alinsunod na rin sa direktiba ng kabinete ng Presidente, yun ang po ang ginagawa po natin sa ngayon. In fact, at the eve of the cabinet approval for the opening of more routes po, we already have opened up in Metro Manila 44 more routes, POJ routes po ito, covering almost 5,000 units. Tuloy-tuloy po yung planning at technical team po natin na tinitingnan. Hindi lang po sa Metro Manila. At in fact, as I mentioned earlier, we had a special RDS meeting yesterday. Binaba na rin po natin yung instruction sa kanila na yung instruction po ng kabinete ng Pangulo for them to also open up routes for that matter. As I mentioned earlier, for non-route based po, wala pong it will not take us that much time because there is no route to plan, there is no route to review, nor modify and approve for that matter. But for the routes that we have to look at, aside from the point of view of LTFRB on transport planning, ito po in the context of containing the pandemic po, we are in close coordination with the LGUs for that matter. Whether it be an intra-city or intra-provincial route, or whether it be inter-provincial route or inter-regional routes po, we have to have close coordination with the LGU because we all know that then, at the end of the day po, kung meron pong mga kaso na COVID doon sa mga nagbabiyahe ng mga pasahero, the ultimate responsibility would rest on the LGU. Kaya maingat po tayo, but at the same time, we closely coordinate with the LGU for that matter. Yung pong nangyari pong pagbubukas ng provincial bus route was actually a product of our close coordination with DILG, pati na rin po yung Union of Local Authorities of the Philippines, which is the umbrella organization of the local elected officials in the Philippines po. But tuloy-tuloy naman din po. In fact, if I may say, magpapalabas na po tayo din this week ng another set of interregional routes going into Metro Manila, coming all the way from Davao City. Pinayagan na rin po ni Mayor Sara ang pagbubukas ng Davao City by way of land trips from Davao City to Metro Manila. So nagpapasalamat po tayo na bukas yung syudad ng Davao to open up routes between Davao City to Manila. So aside from that po, Mabalacat, Pampanga has already opened up that route. So what I'm saying is that tuloy-tuloy po yung ugnayan natin dito sa ating mga local government units para mapabuksan pa natin yung mga ruta na kailangan na buksan po. Thank you very much.
Thank you, Chairperson Delgra.
Thank you very much, Chair. Thank you, Yusek. Joyce Balancho, please.
Yes, good afternoon, Secretary Roque. Kagabi po sinabi ni Pangulong Duterte that there is rampant corruption in the DPWH. Now, following this statement of the President, what is he planning to do next? Will he call for an investigation gaya po nung ginawa niya sa PhilHealth? And given his statements, does he still trust the DPWH Secretary Mark Villar?
Ay, full trust and confidence po kay Secretary Villar dahil despite the corruption in DPWH, nakadeliver po si Secretary Villar. It helps na mas marami pang pera ang pamilya ni Secretary Villar kaysa sa DPWH. No? Pero aside from that point po ay hina-highlight lang naman po talaga ni Presidente yung mga paghamon sa natitirang panahon ng kanyang termino. At ang pangako naman po ng Presidente, igugugol niya talaga itong natitirang panahon para labanan ng korupsyon sa lahat ng departamento ng gobyerno. Lalong-lalo na siguro po sa PhilHealth at sa DPWH.
So will he call, sir, for an independent investigation? Parang bubuo siya ng task force to look into corruption, corruption inside DPWH as he allegedly said.
Posibleng gawin po yan pero hayaan na po muna natin yan dahil sa ngayon po nakatutok pa sa PhilHealth ang Presidente.
Opo, nabanggit din po niya, Secretary, na ideally gusto ng Pangulo lahat ng mga Pilipino mabakunahan ng COVID-19. Is this a target of his administration na bago siya bumaba sa pwesto ay lahat ng Pilipino mabakunahan po?
Well, ang sabi po niya, lahat ng Pilipino mabakunahan ng libre. I'm sure all of us pwedeng mabakunahan pero marami na po niya na magbabayad para sa bakuna. Kaya nga pong assurance ng Presidente sa mga mahihirap, huwag po kayong mag-alala. Una po kayo sa prioridad ng ating Pangulo, hindi na kayo kinakailangang magbayad at gagawin niyang lahat para mauna pa kayo sa mayaman na mabakunahan. Pero actually, kung titignan mo naman talaga ang pharmaceutical industry, hindi po mahuhuli mga mayayaman. They can always buy it, no? Dahil meron naman po silang pera to buy it. Hindi naman po ganun kamahal ang estimate natin sa bakuna. Ang estimate po ni Secretary Dominguez, $10 per dose at kinakailangan 2 dosage. So $20 per person. So 20 million initially po ang bibili natin para sa mahihirap at para po sa ating kapulisan at sa ating mga militar and mga frontliners.
Related question lang po sa bakuna, Secretary, nabanggit din ni Pangulo, interesado daw po ang Russia na magtayo ng pharmaceutical facility dito sa Philippines, related also to COVID-19 vaccine. How will this affect our choice of vaccines given nga po na hindi lang po tayo sa Russia tumitingin ng possible supply ng bakuna?
Alam mo kasi, Joyce, that's a very good news for us kasi nga ang problema ngayon, number one, magkaroon man ng bakuna, ilan ang mabibili natin given na yung mga mayayamang bansa nag-invest na para maging una doon sa bakuna na madedevelop ng mga kumpanya. Ang mga kumpanya na hindi tumanggap ng ganyang arrangements ay ang Russia at ang China kasi hindi naman sila capitalist economies. No? So inaasahan natin na kung dito pa sila magmamanufacture, hindi tayo mauubusan ng bakuna na dito sa Pilipinas gagawin.
Thank you, Secretary Roque.
Thank you very much. Yusek Roque again, please.
Secretary, questions from Virgil Lopez of GMA News Online. President Duterte said yesterday that the government now has the funds to buy COVID-19 vaccines and that he wants all Filipinos vaccinated. How much money has been set aside for vaccines? May we also know the source of funds?
Okay. do the math po, no, kasi I'm bad in math. It's 40 million doses, no, not pala dosage. 40 million doses at $10 each. So, magkano ba yun? Yun po, no? At matagal na po natin naayos yung ating funding scheme. Habang wala pa pong pangtaunang budget for 2021, uutangin po natin yan sa Land Bank at saka sa DBP at iaangkat ng PITC. Pero pag sipa po ng 2021 at kung maipapasa naman po ang 2021 budget, nakapaloob na po itong halagang ito doon sa budget po na pinropose natin sa Kongreso.
Second question po niya, UP Professor Ranjit Rai of the Okta Research Team said in interview yesterday that they expect COVID-19 cases to rise should the government further ease restrictions such as expanding the age group allowed to go out. Any comment on this?
May posibilidad po yan. Pero naniniwala naman ako po na makikinig ang taong bayan ngayong ang endorser ng mask, hugas, iwas ay ang presidente na mismo. At ang tingin ko naman, hindi naman tayo nagkulang doon sa pag-educate ng publiko na madali naman pong maiwasan ang COVID-19 kung susunod lang doon sa mga minimum health protocols. Pero ganun pa man, ang iniiwasan po natin ay yung mga magkakasakit ng malala na walang lunas. So habang binubuksan po natin ang ekonomiya, pinalalakas po talaga natin ang critical care capacity natin dahil alam naman natin na mga 4% lamang ang magkakasakit na kinakailangan magpa-confine sa hospital. At sinisiguro natin na hindi tayo mauubusan ng bed capacity, hindi tayo mauubusan ng gamot, hindi tayo mauubusan ng mga frontliners. Pinaghahandaan po natin yan dahil ang katotohanan naman po habang hindi tayo nagbubukas ng ekonomiya, mas marami po ang nagugutom sa atin. Kaya nga po, talagang maselan itong classification nito kasi hindi na pong usapin na health versus economics. Ang usapin na po ngayon is health versus poverty.
Thank you, Secretary.
Maraming salamat. Joseph Morong, please.
Sir, good afternoon. Sir, okay. Doon po sa strategy natin ng gobyerno, yung test, trace, and isolate. Kagabi sa meeting, dyan ina-attribute ni Secretary Galvez yung pagbaba ng cases, no? Nagkakaroon na rin siya ng traction sa LGU. Now, my question is, how much of this strategy is dependent or reliant on the Philippine Red Cross efforts? Premise first.
Well, by law, sui generis po ang PNRC. It is not government, it is not private. It has a mandate, it has a legislative basis for its existence, but it is not a government agency. And of course, right now, the primary contribution of Red Cross is in the provision of PCR tests. And of course, they have also been active in donating some facilities, no, to treat our COVID-19 cases, no. If I may ask Secretary Galvez to also answer this question.
Sa atin po, nakita po natin, gusto natin magpasalamat kay Senator Gordon kasi yung 1/3 ng ating testing na more than 3 million or 4 million ay galing po sa Red Cross. Nakita po natin noong last 2 weeks ago, they have yung 1 million mark na surpass po nila. So yun po ang napakalaking contribution ng ating Philippine National Red Cross. Sila nag-handle ng ating mga OFW, seafarers, at saka mga returning OFWs. Yung lahat ng one-stop shop natin dito sa Manila, sa lahat ng terminals, ang nag-handle po ng mga testing po niyan ay ang Red Cross. At ang Red Cross din po ay kumukuha rin po sa mga LGUs at saka tinatawag po natin na yung mga private sector. So napakalaki ng tulong ng Red Cross. Nakita rin po natin nung sumabog po ang kaso po dito sa Cebu, ay tumulong din po sila. They donated 14 tents doon po sa mga 11 hospitals po natin sa Cebu. And then also sa ngayon, nakakatulong po ang Red Cross sa pagpreserba ng mga convalescent plasma. Maraming times na po na nakakuha po kami doon po sa kanila ng convalescent plasma na na binibigay po natin sa mga severe patient. Yun lang po at nagpapasalamat po kami sa Red Cross.
Needless to say,
Sir, the reason why I asked...
Yes.
Yes, sir.
Go ahead.
The reason why I asked Secretary Roque and Secretary Galvez is that I am in receipt of a press release from Red Cross that they are announcing that they are going to stop PhilHealth-based swab testing effective midnight, October 14, and that will affect yung hindi na daw po nila itetest yung OFWs, those arriving in airports and seaports, individuals to mega swabbing facilities, frontline health and government workers, at saka yung mga nasa expanded testing guidelines because allegedly may utang pa raw po yung PhilHealth sa Red Cross na 930 million pesos at hindi pa siya binabayaran. Now, sir, question is that what are the consequences kung halimbawa consequences ng decision ng Red Cross to stop yung testing natin, sir, at saka bakit hindi mabayad-bayaran yung 930 million, sir?
Well, I'm flashing in the screen the number of licensed RT-PCR laboratories that we have, 112, and 35 licensed gene expert laboratories. No? So of course, I am not denying the fact that the Red Cross was our major partner, particularly in testing, no? Because they have already surpassed the 1 million tests. No? So gaya nga nasabi ni Secretary Galvez, at least 1/4 of our total tests were done by the PNRC. So malaking kawala po yan kung titigil nila ang testing for PhilHealth. Pero ako naman po ay kumpante na meron lang talagang mga internal problema ngayon ng PhilHealth na alam naman nating lahat. So humihingi po ako ng pasensya sa PNRC on behalf of the President. At tingin ko naman po after this press briefing, pararating ko po kay Attorney Geran, the new President of PhilHealth, itong concern ng Red Cross. No? At bagamat 1/4 ang testing na conducted by PNRC at marami na po tayong mga licensed RT-PCR at mga gene expert laboratories, syempre po kinakailangan pa rin natin ang PNRC kung gusto pa rin pa nating ma-meet yung ating target na 10 million tests. So I don't know if Secretary Galvez has anything to add.
Inaayos na po natin yung problema po sa PhilHealth. Sa ngayon po nag-uusap po si SND at saka si Mr. Geran and then also Senator Gordon. Ang inano po nire-resolve lang po yung yung sa issues ng yung sa MOA dahil kasi yung MOA po na pinamahan po yun ng previous president. Sa ngayon lang po parang humingi lang po ng comment sa DBM for the purpose na para at least clear po yung yung napirmahan sa MOA. Kasi po nag-change po yung yung mga tinatawag natin yung mga prices. And the new president of the PhilHealth, he just wanted to make sure na all is in order. Pagka po ang favorable po ang comment po ng DBM po doon saan po, tuloy-tuloy na po 'yon. Sa ngayon po ang ginagawa po natin, ang strategy po natin, meron po tayong mga high capacities na testing laboratory. So inakuna po natin sa JB Lingad na mataas po ang capacity niya ng 4,500 na temporarily kung just in case magkakaroon po ng pagtigil ng testing po ang Red Cross ay sa kanila po muna sa Lung Center at saka dito po sa area ng JB Lingad at ang mga RITM yung gagawin po natin na ibibigay yung ating mga testing samples sa OFW. Sa ngayon po, inaayos po natin ngayon and I'm confident that the issue will be resolved immediately.
Okay.
In other words, wag naman po mag-alala ang ating mga kababayan. Makakapasok pa rin po lahat ng OFWs because as I said, dati po iisa lang yung ating testing facility, RITM. Ngayon po, 112 RT-PCR laboratories and 35 gene expert laboratories. So makakapasok po ang mga umuuwing OFWs.
Sir, just a little bit on this before I go to just my last question. Sir, kasi how is this going to affect yung maybe question to Secretary Galvez, yung testing natin, tracing and testing because may mga nagtetest ng positive but then yung kasama sa household ay hindi matest because nga of this problem with PhilHealth and Red Cross. So how do we attack that kind of problem on the ground na natitigil or nadidelay yung paghahanap natin at pagtetest natin ng contacts ng mga positive cases?
Can I answer, Spox?
Yes, please, Secretary Galvez.
Kung titingnan natin, yung Red Cross nakadedicate po yan talaga sa OFWs. Yung ating mga LGUs may mga capacity na ng testing. So I believe yung magiging major consequence na pagtigil po ng Red Cross is only for the OFW. Pero yung testing po ng mga first contact at saka second contact, may mga testing laboratory na po ang ating mga LGUs. At saka meron na po silang tinatawag na contract with civilian testing centers. So I believe sa ngayon nakikita ko yung mga LGUs natin, they are now very resilient. At saka meron tinatawag na self-reliant na sila sa testing. Meron lang tayo mga areas na lalo na yung mga nado sa mga ibang regions na far-flung areas, yung mga tinatawag nating GDAS, yung mga isolated. Yun ang ginagawa natin ng paraan na mabigyan natin ng testing capacity as soon as possible time.
Okay.
At
So,
if
sir,
I may
thank you po.
add,
Secretary
Joseph,
Roque?
no?
Yes, sir.
If I may add, yung para sa OFW naman, no? Ang PhilHealth kasi pays both public, private, and PNRC. So kung mawawala po yung mga serbisyo ng PNRC sa ating airport, sa ating pantalan, pwede naman pong palitan for the time being ng mga privado or other public testing centers. But I do hope that the problem will be resolved because our goal is to have more people tested rather than less.
Correct, sir. Thank you, sir. Sir, last question, sir. Just two statements from the President's address last night. Yung pong sinabi ni Presidente na andyan na yung bakuna. How should we take this? Kasi sabi rin niya na parang huwag kayong mag-alala, magka-COVID kayo, don't worry about it. Hindi ba, sir, ito might lead to a lax attitude on the part of the public na parang, okay, nandiyan na daw yung bakuna. Just give us a parang context and just to measure yung, kumbaga, manage expectations na pag sinabi ni Presidente, nandiyan na yung bakuna, what does it mean? Second, yung pong sinabi ni Secretary Duque that we have potentially herd immunity. Is that true, sir? And is this based on science or based on fact?
Well, dun sa sinabi ni Presidente, yan naman po is intended to address yung pandemic fatigue ng ating taong bayan. Alam ko pagod na tayo dito sa pandemyang ito, no? Pero may pag-asa po. Yun ang mensahe ng Presidente. Hindi po ibig sabihin na dapat itigil na ang pagmamask, paghuhugas at pag-iwas. In fact, nagsimula pa lang po yung itong infomercials na ito. Hindi pa po yan bayad ng gobyerno. Nagpapasalamat po kami sa pribadong sektor kasi lahat po yung umi-airing ngayon, lahat ng nakikita nyo sa billboard, lahat ng narinig nyo sa radyo, libre pa po yan. Yung pera po na manggagaling sa kaban ng bayan, hindi pa po makalabas-labas. Talaga pong may red tape. At mabuti na lang, may bagong batas na ngayon na pwede nang sabihin ni Presidente, ilabas yung perang yan. No? At baka nga po pag naisa batas ito, baka itong pera para sa infomercial, unang-unang magiging beneficiary ng anti-red tape law dahil talaga naman pong I have personal experience now about red tape. No? So, yun lang po. Ang sinasabi ng Presidente, huwag kayong mawala ng pag-asa. At meron na nga pong parating na lunas, pero kinakailangan protektahan pa rin mga sarili dahil baka mamaya hindi niyo abutin yung paglabas ng bakuna. So patuloy po natin ang mask, hugas at iwas. Pagdating po sa second question mo, I'll have to defer to Yusek Vergere because that's a medical issue that I'm not competent to answer.
Okay, sir, last na lang, clarification. Anong sinasabi ni Presidente na Lunas? At saan to galing, sir? Meron ba siyang information na some vaccines are already in advanced development, that we are going to get it, mga ganun?
Alam mo, the President is a voracious newsreader. At yung other day naman, I even announced here that a New Yorker magazine already announced that a Chinese company, I think it is CNBG, is about to conclude its stage 3 clinical trials and is in the process of getting approval from the Chinese FDA. No? So once that happens naman po, mabilis ang proseso kasi yung minsan na nag-guest na po dito yung ating FDA Director General, ang sabi naman niya, basta may FDA approval elsewhere, madali na po magkaroon din ng FDA approval dito sa Pilipinas. So although meron pong 3 kumpanya na mag-third phase clinical trial sa Pilipinas, apparently there's one vaccine that is about to conclude its 3rd phase clinical trials, and this is a Chinese vaccine produced by a company called CNBG.
Okay, sir, thank you for your time. Secretary Galvez, regards, Attorney Delga.
Thank you, Joseph. We go back to Yusek Roque, please.
A question from MJ Blancaflor of Daily Tribune on vaccines. During the president's talk to the nation last night, he said he is seeking additional funds to ensure that the entire Philippine population will be given vaccines, since it is the ideal. May we ask, if the president wants to make it free for all, will he source out funds through loans or selling government properties?
Let me answer as the author of the Universal Healthcare Law. No? Dapat po malibre yan. Kaya nga lang, di natin masisiguro nga kung may sapat na pondo ang PhilHealth, hindi nga po mabayaran yung PCR test. No? So kaya kailangan maghanda ng karagdagang pondo ang gobyerno na hindi naman gagaling sa PhilHealth. No? Panguna lang naman po yung 20 million doses, 20 million individuals na 40 doses at $10 each. No? Magkano ba yun? Na-compute yun na ba? More than 2 billion pesos. No? So, hindi naman po malaking masyadong halaga in relation to the total national budget of 4.5 trillion. No? Kaya lang po, since we're a nation of 130 million more or less, medyo malaki-laking halaga yon kung 20 million is already 2 billion. So, roughly, we would need around $12 billion kung ililibre natin lahat ang bakuna. No? Pero I'm confident naman po, hindi kinakailangan ilibre lahat kasi marami naman po can afford $20 for a vaccine. No?
Opo. Second question niya, how will the palace address criticism that the president's vaccine promise is a political placebo?
Hindi po. It is based on science. The fact na ang dami na pong nasa third clinical trial means na nandyan na po talaga ang remedyo. There is light at the end of the tunnel. Ano tawag doon? Tunnel! There's light at the end of the tunnel. So, hinay-hinay lang po, hang in there, malapit na pong matapos ito.
Thank you, Secretary.
Pesos, no? More than? Oo, yung kanina. Yes, Trisha Tirada.
Hi, good afternoon, Secretary, and kay Secretary Galvez and Chairman Delgra po. Sir, balik lang po ako dun sa issue ng OCTA. And at the same time, sir, meron din po kasing, I think, nagkakaproblema yung DNR with expert opinion from the UP Marine Science. We have the DNR slamming marine experts, calling them as bayaran. Then ito nga po, there comes the request for the OCTA team to refrain from putting out to public their opinion or their studies or
only the recommendations. Trish, let me correct you there. I welcome the information that they disseminate and I repeat it over and over again. Yung recommendation lang nila on quarantine classification is what I asked to be privately sent to the president because it's solely the president that can decide on that basis if it's a regional or highly urbanized city and submit it to the local officials for cities and municipalities.
Okay. Sir, ito po, for example, itong nangyari sa DENR, what can Malacañang say about this or the government say about this in terms of how it reflects in the government kung paano po tinatanggap yung opinion ng mga eksperto?
Well, gaya ng sinabi ko po nung last briefing, no? UP has a new charter. It is really a partner of government. And that is why I had to distance. In fact, I will go to the extent of I disagree with the statement of Yusek Antiporda, but he has already apologized for it. So that's my answer. Nasa batas po yan na talagang partner natin ang UP bilang isang national university and as a professor 15 years in UP, ginawa po namin ang katungkulan din namin para tulungan ng gobyerno. In the field of law, we acted really as legal consultants to Congress, no? Because the executive already has many legal offices.
Sir, yung doon naman po sa OCTA team, no? Can you help us understand, sir, ano po yung problem with the UP OCTA team making their recommendations public? Because in a way, sir, hindi po ba mas maganda na nasa sa publiko itong ideas na to? Because if they cannot directly channel the recommendations to the respective offices, mas maganda rin po na, kumbaga, may idea yung mga tao about what's happening, giving them, a voice or at least a participation in the free space for public ideas.
It's the same reason why the Metro Manila governors, although they decide on certain matters and recommend to the IATF, keep their recommendations private. It's the same reason why the IATF, although it represents the entire nation approach consisting of doctors, statisticians, mathematicians, health economists, sociologists, political scientists coming together to address the issue of pandemic, privately recommending quarantine classifications to the president privately. Number one, it's the president that makes the decision. So you don't really need to address your recommendations to anyone else but to the person who will make the decision. And why is only the president authorized to do so? Because this is in the exercise of police powers. Of course, under our existing laws, police powers is shared with local governments, and that is why for cities that are not highly urbanized and all other local government units other than regions and highly urbanized cities, the power vests in the local officials. Now, bakit kinakailangan pribado? Kasi nga po sensitive ang classification. It's an issue of health versus poverty. And we don't want the decision-making process to be mired by politics, because recommendations when made public can form opinions and can have political effect. So let's spare the decision-making process from politics.
Thank you, Spokes. Sir, just one question for Chairman Delgra.
Yes, please.
Thank you. Chairman, good
Yes, sir.
afternoon. Yes, sir. Sir, doon na po sa usapin ng mga jeepney. Because I understand, kasama po ata sa qualification ng pagbabalik or pagpayag sa pagbabalik ng mga jeepney yung roadworthiness. Ito pong move na to, sir, is this, many are asking, is this LTFRB's way of pushing for the modernization of jeepneys? Because in a way, nawawalan po, or the drivers barely have a choice to, return kasi marami po ang hindi roadworthy. Or sir, do they have the option na kung hindi sila roadworthy at this time, mag-comply sila dun sa mga bagay na hindi po mapasa, maybe change engines or whatnot, kung ano man po yung hindi nila ma-comply ngayon. Kapag nasunod po ba yun, pwede na silang bumalik din sa kalsada?
Apo, magandang katanungan po yan, Tricia. But I'd like to put that in perspective on the premise that you have stated. Hindi po, baka maiba lang yung pag-unawa na yung pagbabalik. Actually, pinapabalik na po natin at marami na po silang bumabalik at namamasada na po sa daan. I'd like to state that and clarify that statement on yung pagbabalik po. Kasi nandun na po sila. Ang tanong lang siguro doon, yung roadworthiness issue. Yung roadworthiness issue, hindi naman, sinasabi na rin po ito ni Secretary Tugade. Pinapayagan naman din po yung mga, for example, yung mga PUJ, so long as they are roadworthy. Mahirap naman na hindi roadworthy yan, kung hindi ka naman mamamatay sa COVID, baka mamamatay ka rin sa pollution. Or for that matter, worse, it might be involved in an accident kasi hindi nga siya roadworthy. So we also have a responsibility, pandemic or no pandemic, na yung mga pampublikong sasakyan na tumatakbo has to conform to the minimum standard by which you would be able to measure roadworthiness. Patungkol naman po sa roadworthiness, ang pangunahing ahensya po na nagsasabi kung roadworthy yung sasakyan, yung LTO. Kaya meron po sila yung mga sistema in terms of vehicle inspection, emission testing. So doon po tayo, that is where we rely on the issue of roadworthiness for public utility vehicle. So I hope I have addressed that question insofar as the public utility vehicle is concerned.
Salamat po, Chairman. Thank you, Secretary.
Thank you din
In
po.
regards to Sec. Galvez po. Salamat po.
Thank you, Trish. Back to Yusek Roque, please.
Question from Laila Salaveria. How does the government intend to fund the vaccines to be purchased for Filipinos? Will this be funded by loans or new taxes? What is the estimated amount that the government plans to raise?
Nasagot ko na po yan. No? Kung lumabas ang bakuna ngayon, utangin po natin. Kung lumabas ang bakuna next year, from the national budget.
From Miguel ng GMA News Desk, for Attorney Delgra, may monitoring ba ang LTFRB kung gaano talaga karami sa mga allowed units ng PUV sa Metro Manila ang talagang bumibiyahe? Sa PUJ, halimbawa, ilang percent ng 27,000 ang nasa kalsada, same with modern PUJs, PUBs, UV Express, taxis at TMVS.
Magandang katanungan po yan. Unang-una, meron pong monitoring. Yung ginagawa po natin sa kasalukuyan. How widespread is that is the challenge. Ganito po yung issue dito. Because we're looking, the issue really is whether it's one seat apart or wherever routes that we're going to open, is an issue of capacity, increasing capacity for that matter. Because there is a limited maximum capacity as of now due to the pandemic, meron yung kahit na we would allow public utility vehicles to run on the road, meron pa rin yung alinlangan for that matter or mababa yung kumpiyansa kung kikita ba sila kung tatakbo sila sa daan. So having said that, we need to monitor what the numbers of what has been allowed to the number of actual units that are running. Ongoing po yung monitoring na yan from all types of public transport. But to ensure na yung inallow po ng mga units ay tatakbo, if you would recall, meron po sa Bayanihan 2 yung paglalaan ng pondo patungkol dito sa service contracting. Ang ibig po sabihin nito na yung serbisyo ng ating mga driver at mga operator would be subsidized by government. But the subsidy is based on what we call performance-based. No? Meron po mga indicators na kailangan natin mailagay sa sistema for which they will conform. Why is that? Dalawa pong bagay nito. Unang-una, yung nasa batas na po. Tulong para sa mga driver, 5.58 billion pesos. 3 billion of which is actually for the PUJ drivers. Now, pangalawa, mas maganda na may resulta itong pagtutulong sa mga driver-operator doon na mismo sa ating tinatawag na ultimate stakeholders, yung mga mananakay. Ibig sabihin, we're trying to raise the level of predictability and reliability of our public transport. For example, yung number of operating hours kailangan nakalagay po doon sa programa ng service contracting. So tatakbuhin po nila yung number of operating hours nitong mga drivers and operator to ensure continued service for our commuters. On the side of the drivers po, alam po natin na because of the reduced capacity and there is reliance principally on ridership as a basis for their daily income, minabuti po after so much discussion with our planning and technical team, kasama na rin po yung DOTR planning, na gagawin po nating net service contracting. Ang ibig po sabihin nito, na yung pamasahe na kikitain ng driver at saka, yung driver mismo, sa kanila na po yan. Pero alam natin kulang. So ang gawin po natin, ang sistema po, may dagdag na ibibigay yung gobyerno from the service contracting program para tataas yung kumpiyansa ng mga driver na tuloy-tuloy yung pamamasada nila sa daan. So yun po yung gusto nating, yun po ang pinaplano at yun po ang mangyayari. We are looking at a October rollout of this program po hanggang Disyembre sa ilalim ng Bayanihan 2 Act po. Thank you very much.
Thank you. We call on Pia Ranada, please.
Yes, sir. Good afternoon. Sir, just to pursue the topic on the Octa research groups, your comments on it. Sir, because you justified kanina yung appeal nyo for them to not publicize their results or their recommendations, their quarantine recommendations, by saying that it will fluster politicians, it will pressure the president. But sir, and this was also similar to how Yusek Antiporda justified his outburst. But sir, is the peace of mind of government officials and their reputation more important than the people's right to know the recommendations of these scientists?
Well, number one, Pia, I don't think I said the same thing as Benny Antiporda. I'm sorry to my good friend Benny Antiporda, but he has apologized for it. Number two, again, I can only say it's the same reason why IATF does not publicize its recommendations. Only one person can make or can determine the quarantine classification, and the recommendation must be made to that person, no one else. This is not part of political discourse. It is a political decision, yes, but it is not subject to an opinion poll. The president must be given the leeway to make the right decisions. It's the same constitutional framework as the concept of executive privilege. While there is freedom to information, it's not absolute because the president and policymakers must be allowed to make correct, even if unpopular decisions.
But sir, why would publicizing quarantine recommendations interfere with Duterte making a decision? Kasi sir, many things are politicized and many public interest issues are very political. But isn't it the president's job precisely to make decisions even amid highly politically charged atmospheres such as the pandemic?
Yes, but a pandemic is different. It involves fear. it involves lives, it involves poverty, it involves all norms that we hold dear at the highest level because it's an issue of life or death. So hayaan na muna natin na magkaroon ng leeway ang presidente magdesisyon, and it's not just on the basis of what the health experts say, it's also on the basis of what the health economists say, what the private sector says, what the mathematicians say, what statisticians say. Second point that I don't want to highlight is we are already employing the whole of nation approach in the IATF. And that is why any contributions that they want to make, they're welcome to contribute it to the IATF, and it goes through the process of analysis of all experts in different fields. So ang sinasabi ko lang naman, yes, dahil anyway, wala naman sila talagang data gathering capacity, galing din naman sa gobyerno yan, whatever it is that they want to disseminate, they're welcome to. Kaya nga yan ang dahilan, di ba, Pia, ako pa nag-imbita sa kanila rito. Ilang beses ko na sila na-imbita rito. Ako pa ang nagpa-imbita sa kanila sa palasyo para mag-briefing kay Presidente. No? So it's not that I discount public discourse on data because that's widely available for the people to see. But as far as the recommendations are concerned, let the policymaker make the correct decision regardless of public opinion.
But sir, shouldn't the public also be involved in this decision making? Because even if the president has the power to change the quarantine classifications, it's the people in the end who are affected by the decision. And so I guess the Octa Research Group's recommendations, by publicizing it, sir, na involve yung public with this decision. And it's something also that the president can take into consideration when he makes his own decision, diba, how the public parang sees the data provided by the scientists. But sir, moving on, sir, yung another issue I would like to ask about is
I don't know. Wait a minute. You're arguing.
All right,
You're
all
not asking a question. And I'm going to answer that first. While the people have a right to know the data, they do not have the power to make a decision on the quarantine classification. Only the president and the local officials have. That's clear. But the data is there. We share it with the people. We tell them this is the data. That is why you must continue to wear mask, wash your hands, observe social distancing. I think you have asked 3 questions already. Correct?
Sir, just on River Mendocino, sir. Yung baby river lang sana.
But you've asked 3 questions. Let's see if we have time for round 2, okay? To be fair, not to everyone. Inaccuse na nga ako favoritism dahil may mga ilan daw na nakakaapat na question, and that includes you and Joseph Morong. I hope you understand. Okay, next question, please. Yusek Roque, please.
Yes, Secretary, from Ivan Mayrina ng GMA7 for Chairman Delgra, Chairperson Delgra. In terms of percentage, how much of an increase are we planning to implement? If we are currently at 50% with buses and jeeps, how about po yung trains? And when are these going to be implemented?
Magandang katanungan galing kay Ivan. Unang-una, as I've mentioned, the instruction is already downloaded. And then, among other things, as I've said, we're in terms of increasing capacity for provincial buses, we will be opening up additional routes this week. Pagdating naman po dun sa porsyento, actually medyo mababa yung sinabi ni Ivan na porsyento. Umabot na po tayo sa mga, if I'm not mistaken, mga 68 or 67, 69% of our public utility vehicles dito sa Metro Manila po. But that also, insofar as the other regions are concerned, as I've said, we work closely with the LGU in having to increase capacity. Now, the timeline is there, and in fact, it is ongoing, and that we would be able to significantly increase, if I may say, the number of vehicles as well as increase capacity. I would like to emphasize that. Kasi isang aspeto in increasing capacity is adding more units. But the other aspect is also having that unit run on the road longer than they would want to or they would need to. Kasi nga walang kumpiyansa sa pagpapatakbo, either because of lack of passengers or, for that matter, during times of the day, at certain times of the day, or lack of prospective income, in terms of reduced capacity. So tuloy-tuloy po ito insofar as this one is concerned. you would be able to see a significant increase perhaps in the next 2 to 3 weeks, but definitely December would be too far off already insofar as the timeline is concerned.
Okay, thank you, Chairperson Delgra. For Secretary Galvez, question from Sam Medanilla. Ano na daw po ang update sa pilot testing ng antigen testing sa Baguio? I-implement na po kaya ito sa other areas po sa bansa like Boracay for Secretary Galvez po?
Sa ngayon po, ongoing pa rin po ang testing po natin at hindi pa po tapos yung evaluation. So I cannot speak more on the evaluation side because it's the DOH that can have this. And sa ngayon po, nag-usap po kami nila Mayor Magalong. Ongoing pa rin po yung kanilang pilot testing.
Thank you. Thank you, Secretary Galvez.
Okay, so one last, Melo Acuña, please.
Good afternoon, Secretary Harry. Good afternoon to all the other guests.
Good afternoon.
Kalakhan po ng ekonomiya natin ay nakasalalay sa paggastos ng mga mamamayan. Binalita po ng Bangko Sentral kaninang umaga na bumaba yung remittances. Ano po kaya ang paraan para mayroong magastos ang mga mamamayan at mapasiglang ekonomiya, Secretary Harry?
Well, kaya nga po importante itong ating 2021 budget dahil bukod pa sa mga stimulus na pinrovide natin sa Bayanihan 1 at sa Bayanihan 2, napakalaking stimulus po ang napalaob dyan sa 2021 budget. No? Nandiyan po yung mga additional na pautang para magkaroon ng hanap buhay ang ating mga mamamayan. Galing po yan sa Small Business Corporation, galing po yan sa DTI, galing po yan sa DOF, galing po yan sa DA, galing po yan sa Department of Labor at sa Department of Agriculture. No? Nandiyan po yung mga pinaplano pa rin po mga suporta sa mga critical na mga industriya, no? Gaya ng aviation. No? At nandyan din po yung ating mga programa pa na nagbibigay ng pera in exchange for work, gaya ng TUPAD, AKAP at CAMP na pinatutupad po ng Department of Labor.
Opo. Meron po dineklarang curfew yung ibang bansa sa Europa mula alas 9 ng gabi hanggang alas 6 ng umaga. Ano po kaya ang pulso ng IATF sa curfew sa Pilipinas?
Well, ang rekomendasyon po ng gabinete sa mga local government units ay paikliin ang curfew. Siguro iba ng karanasan natin sa Europa. Kasi sa Europa talaga namang hindi sila nagstrikto ng pagko-quarantine. No? Kung pupunta ka nga sa iba't ibang lugar ng Europa na matataas ang kaso, hindi sila nagsusuot ng mask, no? At hindi sila nag-alcohol. No? At nagkukumpul-kumpulan pa rin sila bukas sa mga bars. Let's just say, well, policies have their ramification. Tayo po, habang tayo nagbubukas ng ekonomiya para mabawasan ng mga nagugutom, patuloy po ang ating kampanya, mask, hugas, iwas, at saka wala pa rin pong pagtitipon.
Yes. Secretary Harry, for Secretary Galvez, good afternoon, Secretary Galvez.
Good afternoon.
Foreign Secretary Teddy Locsin and State Councilor Wang Yi agreed over the weekend to come up with a fast lane for Chinese and Filipino workers. I asked DFA about the operationalization of this. However, DFA said it will depend on implementing agencies and the recommendations and guidance of the IATF. Have you considered anything like this to operationalize the fast lane?
Sa amin po kasi sa NTF, yung mga ganun po na inano po namin, case-to-case basis po kasi yung ginagawa po namin sa National Task Force. So, pero yun, i-consult ko po kay Secretary Roque ang ano po nito dahil kasi sa kanila po talaga ang clearance po nito.
Okay. Maraming salamat po. Thank you. Thank you.
Thank you.
Secretary Harry.
Yusek Roque, do you have more questions?
Yes, Secretary, may tanong po dito for galing kay Sam Medanilla for Secretary Roque. May timeline na po kaya ang government kung kailan magkakaroon ng significant improvement sa economy after ma-implement ang recommendation ng economic managers? Will this happen during the last quarter of the year or next year na po?
Well, alam niyo po, pagpasok ng Burr months, ito po traditionally ang pinakamalakas sa pagdating po sa retail. No? So inaasahan po natin na nagbubukas tayo ng sapat para magkaroon po ng maximum opportunity ang merkado na makabawi doon sa napakalalim pong pagbaba ng ating ekonomiya. So sana po itong buwan ng October, November, December, we can somehow catch up nang hindi naman po ganun kalaki ang naging contraction ng ating ekonomiya. Dahil sabi nga po nung isang bangko, no, we will suffer the worst contraction, no, in the whole of Southeast Asia. Kaya humahabol po tayo. Pero siyempre po, kaya po natin gawin to. Pangalagaan lang natin ang ating buhay para tayo makapaghanap buhay.
Opo. For Chairperson Delgra, from Chris Jose of Remate, posible po kaya na ang provincial buses ay makapasok pa within Metro Manila? Kasi di ba sa ngayon ay hanggang PITX lang po sila? Salamat po.
Okay. I think there are two aspects dun sa sa tanong na yan, Yusek. Unang-una, yung polisiya na magbubukas na yung Metro Manila for the provincial buses. Andun na po. We already have opened up the initial 12 provincial bus routes coming in and from Metro Manila. Right now, ito po yung sa mga neighboring provinces ng Region 3 and Region 4. As I've said earlier, tuloy-tuloy po yung pagrepaso at sa pag-uugnayan sa mga LGU para mabuksan pa at dadami pa yung provincial bus route na papasok sa Metro Manila. Now, I think insofar as the second part of the question is concerned, kung hanggang PATX lang po ba, yung pagpaplano po natin dito at the start when we resume public transportation in June 1 po, we also have revised the routes, the existing routes for buses and UV Express and PUJ po. So what we're saying is that we have spread out these routes of different modes, of which minarapat na pinaghandaan po natin na pag magbubukas na po tayo ng provincial bus routes po, hihinto na lang po sila doon sa mga yung tinatawag po nating integrated terminal exchanges na inspect na po, hindi lang po sa LTFRB at DOTR, kasama na rin po yung MMDA dito. So we have inspected 4 or 5 integrated terminals, 2 up the north, and then there's one in the middle in Cubao, as well as in the 2 others dito po banda sa south, no? Alabang and Santa Rosa, and also PTEX as mentioned earlier. So ganun po yung sistema na gagawin po natin dito, kung saan yung pagpapasok at pag-aalis ng mga provincial buses po would be coming from these integrated terminals and would also end up in these terminals. That way, considering that we're also addressing public health here, yung mga public health protocols are also in place in these integrated terminals.
Thank you, Chairperson Delgra. Thank you, Secretary Roque, Secretary Galvez.
Maraming salamat dahil wala na po tayong mga tanong. Meron lang po tayong mensahe sa mga magulang, mga tatay, mga nanay, at mga chikiting. Habang wala pa pong bakuna laban dito sa COVID-19 virus, meron naman po tayong mga bakuna laban po sa mga sakit gaya ng measles, rubella, at polio. So wag po tayong matakot. Gamitin na po natin itong mga tried and tested na mga bakuna laban sa measles, rubella, at polio. No? At ito po ay gagawin yung pagbakuna sa lahat ng ating health centers mula October 26 hanggang November 25. Isang buwan po yan. October 26 to November 25, libreng bakuna laban po sa measles, rubella, at polio sa lahat ng ating mga health centers. Bago po tayo magtapos, maraming salamat po sa inyong pagtangkilik sa ating press briefing. Salamat po sa mga miyembro ng Malacañang Press Corps. Salamat kay Yusek Roque. Maraming salamat sa ating naging panauhin, Secretary Galvez at LTFRB Chair Delgra. At syempre po, no, bago po tayo magtapos, ulitin ko lang po, habang nagbubukas po tayo ng ekonomiya para maiwasan ang mas marami pang Pilipino na magutom, kinakailangan po pangalagaan ang ating mga buhay para tayo'y makapaghanap buhay. Sa ngalan po ng Presidente natin, Presidente Rodrigo Roa Duterte, ito pong yung Spokesperson Roque nagsasabi, kaya natin to, we will heal as one, at panuorin po natin ang video ng DOH para sa libreng bakuna from October 26 to November 25.